Hello guys, I'm Dr. Ishani and I completed my MBBS from Jawaharlal Nehru Medical College, Bhagalpur. I was a student of 2016 batch and I completed my internship in October 2022. After that, normal path that any MBBS student take after their UG, that is MBBS, is generally doing PG, either MD, MS in medicine, surgery, obsgyny, pediatrics. These are most short after fields. Also radiology, dermat. How can I miss that? But I was, I don't know, not in that zone, or I just like from even. So during MBBS, from second year, our wards round used to start, where that is clinical rounds, where we used to examine patient and our teachers used to come and teach us. During that time, I was interested in medicine and I wanted to pursue it. But as I moved forward, I did not like the clinical aspect of medicine that much. During third year, I had my doubts. I thought of doing either UPSC or management, but I could not connect with anyone and there was no one to guide me. So I thought, ki Ishani, let's do internship, like you do internship, and then maybe you feel that you want to pursue in future. But when we started internship in 2021, I tried that okay, let me find a field that is more relatable to me, that I could continue. But I could not. And during May, I connected with a few people on LinkedIn that did MBA post MBBS, and also people that did Masters in Hospital Administration from TISS post their MBBS. So I talked to them. Actually, the TISS story dates long back, like in third year when I was confused. I saw people doing Masters in Hospital Administration and I was very intrigued and just curious as to know this aspect of healthcare, where obviously clinical part is very important, and I owe great respect to everyone that pursue that or do practice that. But it's just that people are different and their interests and likes are different, so I wanted to pursue the management and clinical aspect of it. So I started preparing in May 2022 for MBA or Masters in Hospital Administration per se. So during my preparation, I had to switch completely from clinical subjects, those 19 subjects. And I'm not bragging, but it was not that I was very weak in MBBS subject. I was in fact class topper in my final year batch and did receive gold medal. So it's just that I could not connect with it, and I wanted to pursue this management aspect. So for the preparation, I started studying maths, English, and general knowledge, also logical reasoning and DILR. I was initially very skeptical and apprehensive that could I do it, am I capable enough, or such doubts used to creep me often. But then I thought that if you have made a decision, try, just give it one. If you have made a decision, then you should give a try. So I started studying for it. During that time I was not the CAT exam was in November 2022. I prepared I guess 50 to 60%, but still 40% was remaining, so it did not go well. Then I gave TISS, and TISS was in Feb, so I got some time to prepare for it, and yes, it did go well. And I also revised 1 month GK for that. For all the TISS preparation of theory or interview, I will make a next video for that, for any TISS aspirants. And yeah, so continuing that, I gave my theory exam. I was not very sure, but I was knowing that it did go well, but I did not know how the cutoff will go and what will happen. So when in March the result came and I was selected for the interview, I was very excited, also apprehensive, because initially I thought of doing MBA and then whether to pursue Masters in Hospital Administration or not. I had thought of doing Masters in Hospital Administration as well, but my prime focus at that time was MBA. So I talked to many people from TISS, and yeah, they were saying, so I talked to few people. I talked to a lot of alumni of MHA, alumni, and they guided me that it is a good choice to make for an MBBS student, because you will stay connected to your core field, which is medicine and healthcare. And my prime focus of doing this master MBA also or MHA was to do something big in healthcare, to revolutionize healthcare. When I was in Bhagalpur, I used to see patients dying of meager facilities and resources. So I wanted to change it. I felt that the healthcare need a revolutionary change. There should be a fundamental alteration, so that we could make healthcare affordable, accessible to each and every person. And I know that as a clinician also you can do that, but I wanted to do that on larger scale in my lifetime. So that's why I opted for it, and MHA resonated with it because it will keep me connected with the healthcare. And the curriculum, if you go and see it, it is very much elaborated. It includes everything that I would like to learn. And yeah, so that's why I came here, and I'm now TISS MHA student. I qualified the theory interview, and I will be starting as TISS MHA 2023-25 batch. Signing off, Dr. Ishani, and stay tuned to this channel. Please subscribe, share for my future videos on my life as an MHA student. Also, I will share my insights as an MBBS student also, for those who would like to know. And yeah, and obviously guides to crack TISS. Whoever wants to stay connected, please like and share, subscribe. Thank you.